Yeah, bone-on-bone osteoarthritis of the hip and knee. So Freda came in about 3 months ago, right? And you did not want to get your knee or hip replaced, correct?
I need to walk.
Yeah, because you wanted to walk.
I see the problem is I have a little scooter at home, and I'm supposed not to have it.
Yeah.
Then you sit down and
then you depend on it. So
I should walk.
we decided to do the laser stem cell for your knee and hip. 3 months later, how do you feel?
I feel good.
All right.
I have no pain.
Good.
But yesterday it seems like
little groin
I walk
issue?
at night, you know, and I don't take any pain pill.
That's
but
good.
I need to walk more.
Yeah.
But
Now that your pain is gone, we could get you walking.
I mean, I got to get off this thing and this thing, but I have a very bad back, and they told all the doctors told me it's full of arthritis.
Mm-hmm. So now that your hip and knee's better, we're going to work on your back now. So how many % better do you feel 3 months later? Look, you said 75% better. Wow.
Oh,
And how young are you this year? How young are you?
But I thought I'd give you a little shock.
All right.
It's just sometimes lately I feel something in here.
Okay.
But the first couple of days in here, it's really, but it goes away.
Oh, that's good.
My husband tells me it's all up here.
Yeah, all right, all right. So how young are you this year? Huh? How young are you this year?
Yeah, it's fine.
How old are you this year?
Oh, how old I am?
Yeah.
I'm 91.
So it doesn't matter how old you are.
My husband is 94.
It doesn't matter how old you are.
Driving.
Yeah, the stem cells are day 0 old, so going to repair. Okay? And as they say in Deutschland, ausgezeichnet.
Okay,
Okay, that's how we do it.
There you go.